Hello everyone, thank you so much for coming out and supporting AB 1400 with us today. My name is Francine Imai, and I'm a former Sakura ICF Family Council member and a SOS volunteer. I'm honored to share with you in the house of the Lord today, and the topic I'd like to share with you today is greed and how proper health care for the elderly is so very essential. My mother resided at the Sakura ICF from November 2018 and was transferred to Atherton Baptist Home due to health issues that could not be provided at the ICF as of May of this year. She passed on September 11th, and we just laid her to rest on November 6th. I strongly feel that due to Pacifica's greed and the lack of compassion for the residents at the ICF, my mother's health went downhill very quickly. The ICF was her home. The staff became her family during the pandemic when we could not visit. After my mother heard that Pacifica was planning to put up multi-million-dollar family homes and tear down the ICF, her health declined very quickly. She was worried where she would go. ICF was her home. Beverly Ito and her staff went above and beyond to make the ICF their home. And it's just so sad that the ICF had to close. I can honestly say that I've never seen or heard of another nursing facility that had the same care. We asked Pacific to please keep the ICF open until the end of the pandemic, but they wouldn't budge and forced us to relocate our loved ones and take many residents that were in their care for over a decade. And they were from 80 to over 100 years old of age. And they all had to go to a strange and unfamiliar place. Besides my mother, there were a total of 3 other families that I know that also lost their loved ones. I don't understand how Pacifica could be so heartless. Had Pacifica allowed them to stay in the ICF during this pandemic, would they still be alive today? We will never know. God is the only one that can answer this question. It is so very unfair that our elderly work so hard to make our country great, and they're now being forgotten. Prior to the war, many Japanese had thriving businesses in Japanese town in Little Tokyo area in Los Angeles. Their businesses, homes, and possessions were taken away, and they were sent to concentration camps. It doesn't seem fair that they had to end their elderly lives by taking what they called their home away again. Let's not forget our elderly that built this country, no matter if they are yellow, red, brown, orange, black, or white. All lives matter. It is so very important to our country to provide proper health care for all, and not to forget the elderly. I ask you to please support AB 1400. Thank you so much for allowing me to share. God bless you all.
Thank you, Francine, for sharing your story. Hi, my name is Ken, and my mother was also a resident of Sakura ICF. Also evicted from the facility when Pacifica chose to close this facility down to establish and build a housing complex there for sale. So my mother is still with us. She's now at another facility which does not unfortunately provide bilingual care. She's been living in the United States for over 60 years now, but she is a Japanese immigrant and never really never really gained, I should say, the ability to communicate in English very well. So language is a very central part for her still to this day, and she needs Japanese language care. She was getting that in a wonderful setting, as Francine just mentioned, at the Sakura ICF, and the nurses there were bilingual, and really it was a wonderful environment for elderly parents like Francine and my mother, Francine's mother and my mother. Unfortunately, she is now at a facility which doesn't provide that care. What a lot of people don't understand, I think, is that elderly care, health care, actually requires a lot more language competency on the caregiver, because it is not simply an emergency room situation where maybe the stay is for a day or two, or even on a hospital stay, in which a stay may be a few days. It's a 24/7 contact with the residences and the health caregivers. And this is a very critical difference between elderly care and what would be considered more critical or emergency care. And this is really a germane topic for the multicultural, multi-ethnic community that we have in Southern California, because it's everything from a small concern to the familiar smell of your foods that you're used to preparing. My mother used to prepare, of course, as all of your mothers did, I'm sure, on special occasions and on New Year's Day, special dishes that are special for your particular culture or ethnic background. And it's very important to have that as part of their care as they now reside in their facilities. And all of these things, as was just mentioned by Mr. King Chung just a few minutes ago, just the simple fact of having rice available for dinner is a very important part of the care of these elderly residences. And so when these things change and they're taken away from them, it's really a very, very difficult time, I think, for many of these elderly residences and members of our community. So bilingual care is an absolute essential feature, I think, of the diverse cultural and ethnic communities that make up LA, and it has to become a part of regular healthcare. So I urge you all to support AB 1400, and thank you for giving me this